So, a very good evening, everyone. I hope you can hear me. Yeah.
Yes, ma'am, you're audible.
So, I'm very, very delighted, really overwhelmed to see the response we are getting from your very enthusiastic participation. We started with 450 registrations, but on request we have crossed 500 now, and we had two WhatsApp groups. Now today we had to make a third WhatsApp group, so I really appreciate that, and I am really enjoying the motivation of all the participants, and it's quite infectious, I suppose, because it's motivating us also to perform much better. So with this, I welcome you all to this day 4 of the season 2. Today we have two prolific speakers. Dr. Neeraj Gugnani, who is the first speaker, will be talking on the reviewing of a case report. And we have Dr. Kathy Fan from UK. She'll be talking on reviewing an original research. So let me introduce the speakers. Dr. Neeraj Gugnani, he is a postgraduate from King George's Medical University, Lucknow. He is professor, Department of Pediatric and Preventive Dentistry at DAV Dental College, Yamunanagar. He is MSc Clinical Trials from University of London. Numerous awards and accolades to his credit. He has been Commonwealth Scholar in 2008 when he visited Manchester University of Manchester. He received ORCA Travel Fellowship Award. As you can see, he loves to conduct workshops and courses, not only on dental areas, but also on clinical trials and systematic reviews. He has more than 70 publications, and he's a member of many scientific societies. And our second speaker for the day, Dr. Kathleen Fan. She's consultant oral and maxillofacial surgeon at King's College, London. Really happy to have you here with us, Kathy, today. She's council member, British Association in Oral and Maxillofacial Surgery, National Media and Communications Lead of BAOMS at NHS England in the Dental Subgroup Committee. She is BDS from United Medical and Dental Schools, Guy's and St. Thomas Hospital in London. Then she did her MBBS from Royal London and St. Bartholomew Hospitals University. Then she did her PhD from University College London. Then FDS RCS, followed by FRCS in clinical surgery, and then FRCS OMFS in 2007. Really good researcher. I have very good bioengineering course also she's running. She's into 3D bioprinting as well. So lots of things to her credit. We'll get to know her more when she speaks to us as a second speaker today. Continuing with the talks and discussions we had yesterday, let me take you to a few, if I'm allowed. Okay, I need to stop share and show you some of the articles where we're talking about how most of the time we can have people as first author. So maybe two people can be the first author, or maybe two people can be the corresponding author. So just to show you a few papers where you can appreciate how. So this is a paper. This one, if you see, this is a paper somewhere in 2011, where there are so many authors, but if you look at the corresponding author, there are 3 corresponding authors actually. Okay, so 1, 2, and 3 corresponding authors, and they have equal contribution. This is how it is done. So when you're doing assigning the roles and the contribution of each author, at that time you have to tell the role and the contribution. That's how it is taken up. And in the second article, again, we'll share you with these articles in the group as well. And the second article is from JBCR only, where you can see that equal contribution is requested. So those people with the number marked as 1 have been given equal contribution. So although they are Kapila and Mani as first and second authors, but both have got the contribution as equal. So they are benefited as the first author. So I think that may solve your query. With this, I now invite Dr. Neeraj to take over and present his lecture. Thank you.
Thank you so much, ma'am. Am I audible?
Yes.
Perfect. Thank you so much for inviting me on this beautiful platform. And just give me a moment. I'll start sharing my screen.
Yeah.
Perfect. Visible?
Yes, perfect.
Perfect. So today I'm going to speak on fundamentals of peer reviewing a case report. After 3 days of fantastic sessions going in the evening, keeping us all busy in learning something new about peer reviews and authorships and everything about the ethics and jurisprudence of the cases and publications. Today brings you some fundamentals of peer reviewing of a case report. Before I start, I convey my sincere greeting from my DAB Dental College, which is in Yamunanagar. Myself, Neeraj Gugnani, I did my MDS from the same alma mater, KGMC, and I did my MSc in clinical trials from University of London. So first question is, what are case reports? Every case we do in everyday life is a new case, but it may not be novel enough to be reported. A case report are descriptive studies meant for illustrating very novel, very unusual, or an atypical feature identified in a patient in medical practice. So case reports have to be very novel. And the literature is not very clear when to define it as case series. So there is a controversy about case reports and case series. Some literature says more than 3 cases should be called as case series, but however, some literature also says more than 1 case should be reported as case series. But one thing is very clear, that case series provide a bit stronger evidence than case reports. But if we see overall, what is the evidence from the case reports? In the pyramid of evidence of healthcare, we all know that case reports or case series are really at the bottommost tip of the pyramid. So if they are so bottomly placed, should we really be interested in publishing them? For understanding this, we need to understand the disadvantages versus advantages from a researcher's perspective. So I have kept the word disadvantages first and then the advantages. So disadvantages of publishing a case report means because they're observational studies, they lack control, as in randomized control trials. The cases may not be very much generalizable. The follow-up may not be very much complete. However, the advantages include it helps to broaden the medical data. It helps to formulate new hypotheses. It helps to identify rare manifestation of a disease, a new representation of a disease, a rare manifestation of a drug, a newer side effect. So there are so many advantages also. So that's why we should keep publishing the case reports also. One very important thing is that these case reports really help us to make new hypotheses. That means they can form the basis of new clinical trials. So there is no reason of not getting ourselves motivated to publish case reports or case series. So if we just focus on the instruction for authors as given in the various journal manual books, so most of the journals in dentistry allow and invite case reports to be published, and they have specific requirements for that. For example, the first thing very clearly says about the number of words allowed. The second communication clearly tells that only exceptional case reports are considered for inclusion. It goes further and says case reports do require ethical approval. The third from another journal clearly mentions that it should be illustrating unusual clinically relevant observations are only acceptable. So different journals have different requirements, but they do really invite case reports. Editors, readers, and everyone in this community is interested in case reports. editors, reviewers, and everyone in this, every stakeholders is interested in reading case reports if they are able to provide something very novel, something very unusual and relevant and interesting to the whole scientific community. So what is the publication process? We all have seen this in the last 3 days. First is authors. They submit the manuscript to the editors. The editors may reject it or may send it to peer reviewers. Peer reviewers will give a critical review and a feedback back to the editors. This will be sent back to authors, and after 2 or 3 cycles of reviewing and editing the cycle, the manuscript may get accepted. Once it is accepted, it goes back to publication in the dentistry journals, and that is read by the readers. Do remember that we, all of us, have to play different roles at different times. One person can be an author one time. For another article, he may be a peer reviewer. For another article, he may be a reader. So that is the sequence. So a good author can only become a good peer reviewer. A good reader can only become a good author. So these 3 roles are played by different people, same peer person at different times. So we should be able to understand the roles of all 3 persons. That's why I've used them in the same color. One person can author for one article, a peer reviewer for another, and a reader for the third article. So all 3 these persons have different responsibilities and roles for this at different times. For example, authors need to follow guidelines to submit their manuscript or prepare their manuscript. Reviewers need to check and confirm the apt use of these guidelines along with other duties. And readers need to check whether the article is really useful by using critical appraisal checklists. So we just cannot focus on the role of peer reviewers today. We need to focus on all 3 roles and how they are integrated with each other. That is very, very important. So are there any reporting guidelines for authors? All of you know that there are so many important publishing guidelines for different types of studies. Easily available at Equator Network. We all know that this is a fantastic website. Today, I'm just going to focus on these case reports that is to be written with the help of CARE guidelines. In addition to these CARE lines, author should also know the guidelines specified by the editor for the journal. So peer reviewers should be well versed. So no doubt author should be well versed with these 2 guidelines. But peer reviewers should also be well versed with the general reporting guidelines that includes CARE in this case and specific guidelines or specific requirements for that journal. So do journals also, dentistry journal also ask us to use these guidelines? So my answer is yes. Most of the journals give the direct link to these guidelines and ask us to follow these guidelines as an author. So for a case report, authors can use CARE guidelines. These CARE guidelines, the word derives from the case and report. So CA and RE. These CARE guidelines are a 14-point checklist which help us to frame a case report for publication. It starts from title, keywords, abstract, introduction, then details about the case, then details about the follow-up, and then the ethical and other information. For those of you who think they would not be able to use CARE checklist thoroughly, or they may skip some things and very skeptical, they want to write a very good paper, I'm going to show a very interesting thing that is a new website which is called as carewriter.com. It is a free website. This website can help a new author to write a case report following all the CARE guidelines in a very flow manner, in a very easy and lucid manner. So as soon as you open this website and you just make your account and start adding a new case, and that means writing a new case report, just click on this add a case. It will open a window, title. So you just write a title and that will create a case. Once you write a title, it will ask you to enter the keywords. So you write 2 to 5 keywords. Once you do this, it will lead one by one in Windows will open, and all the 14 elements required in the case report can be entered over there. So this will be followed by a freely downloadable paper as PDF or as Word, which can be read, edited by you, and then finally submitted to the editor for your further processing. So this CARE writer automatically allows you to not to miss any of the 14 things, and a perfect case report can be framed using this. Now, guidelines for surgical cases. We are dentists, we are oral surgeons. We need to not only follow the care guidelines, but I urge you to use these extensions also. Now, what is these extension called as? These extensions lead us to a newer guideline, which is called a SCARE guideline. That means case reports in surgical fields. So dentistry overall always requires some kind of intervention. An endodontist might be doing intervention like root canal treatment. A pediatric dentist might be doing intervention like myofunctional appliances or some kind of class 2 or class 3 fillings. A surgeon always does some kind of TMJ ankylosis surgery or some other surgery. So we need to also follow, in addition to this care, we need to focus on SCARE guidelines, which is a relatively newer guideline, surgical case report guidelines. And this is the website scareguideline.com. So do remember, if you are not a good author, you cannot be a good reviewer. So to become a good author, you need to follow all these guidelines depending upon the type of study you are following. So how are peer reviewers chosen? So now coming to the second step, as an author, you have now fulfilled your responsibilities. Now coming to the duties of a peer reviewer. So first is that how are peer reviewers chosen? As was mentioned yesterday in two of the presentations, that editors will choose peer reviewers who are expertise in the field, depending upon the availability and ability to commit time, sometimes preferred or opted or chosen automatically. And then it is sent to a double blinded peer review. Do remember, in all these steps, whenever an editor is choosing one or two reviewers, he has something in mind, he or she has something in mind. And what is that something in mind? When he is or she is referring to a case report, that he wants a peer reviewer to tell on these points back to the editor. That means a peer reviewer should check for the rationality, novelty, case description adequacy, evidence to support the diagnosis, is the literature search updated, is our ethics being followed. So an editor wants a peer reviewer to answer all these questions in case of a case report back to the editor, so that he or she can take a judicious decision. Now, how these questions will be answered by a peer reviewer, that is very important. So steps for peer reviewing, it takes 5 steps. So a peer reviewer will follow these 5 steps to help or to guide the editor to answer 5 questions to the previous questions. These 5 steps include these things. First, read the whole paper in first go to understand the context of the paper. Second, focus on individual elements. That means the second reading. Third, check for patient anonymity, consent, and ethical approval. Fourth, evaluate the impact on the clinical practice of that particular case or case series. Fifth, feedback to authors, suggestions, and comments to editors. So if you follow all these steps, then the true job of peer reviewer will be complete, and you will be definitely able to understand or answer all the editor's queries. As a peer reviewer, I am saying now. So step 1, read the whole paper to understand the context of the paper. Check for the flow of the paper, check for the novelty of case report, review about uniqueness. Novelty can be true representation of a common disease, a procedure, a true novel way to perform a procedure, or even a reported side effect. Do remember that journals are interested in publishing uncommon presentation of common diseases or common presentation of uncommon diseases. So whenever you are doing a procedure or happen to see a disease and very uncommon presentation of ameloblastoma, but a common presentation of sphingomyocele or something like that will also be okay. So these two things leads to novelty or uniqueness, and your papers, in the first go, the peer reviewer can check for these things. The last thing in the first go, any significant flaw. The step 2, while second reading, the peer reviewer should follow on the individual elements. If authors have followed the care or the SCARE guidance, that should be checked by the peer reviewer. So a peer reviewer will check all these things one by one. How he will check? Title, check whether it is succinct and self-explanatory, and preferably it should have included a word case report. In the keywords, do check relevant use of case words, keywords, and check for the use of mesh words. As a peer reviewer, do confirm whether the journal requires a structured or an unstructured abstract, and if structured abstract, check for all the points. As a peer reviewer, if you go further, then check for the introduction. The introduction should have been written in such a way that it should be able to things in context. Very important that the literature should have used have been very updated, and it should be able to depict its novelty. Very, very important for a case report. Patient information. Check whether all the information, all the photographs, everything has been de-identified. So the patient should be, information should be anonymous. Timeline as per the care guidelines should be very clear and preferably organized in a figure table showing all the sequence of events as per as per the timeline. Then the diagnostic assessment. Check for all details of diagnostic methods, X-rays, blood reports, these and prognostic characteristics also. Check for the clinical findings. Check for the reporting of physical examination, specifically in ortho-related cases like specifying occlusion. In surgical cases, specifying about the patient's physical appearance, blood reports, suitability for surgery, etc. Therapeutic intervention, very important to report about pharmacological, surgical, or preventive, or whatever intervention you are using. Now here, the special focus should be on using the SCARE guidelines, because surgical intervention details also require us to mention pre-procedural things, procedure in detail, the rationale for a surgery, the operating details, and the focus on novelty effect. So everything is very, very important, but never forget, everything reported should be replicable. So in a clinical research, we always say that methodology should be written in such a way that the whole experiment is replicable. In a case report, I would say that the whole case should be written in such a way that it brings a animated picture of the patient in front of us. Everything should be written in such a transparent, lucid, and flowable way that everything becomes replicable. So going further, the last three things, the follow-up and outcomes, clinician and patient assessed outcomes, length of follow-up, very important, because that will help us to determine the suitability of the paper. Discussion and conclusions. In discussions, we should always focus on strengths and limitations together. So it should be a balanced kind of discussion, and discussion of relevant medical literature. Within the conclusion, we should always tell primary takeaway lesson. In all the case reports, this takeaway lesson and how this is how you can take this back to your own medical practice is very, very important. The last thing about from the care guidelines, you can check about the patient perspective and informed consent and ethical approvals. Do we really require informed consent and ethical approvals? Sometimes it comes to your mind when you are really reporting about case report. So going further, the step 3 is check for patient anonymity, consent, and ethical approval. I have made it as a separate step. So patient anonymity, very, very important, because specifically you might be dealing with only one case, and it sometimes becomes difficult to de-identify. Rather, it is even become more important for the authors to make all the information anonymous and confidential. So you should also check, as a reviewer, you should also check that all the patient identifiers have been removed or masked from the, and including the text as well as the photographs. We know that readers usually blacken the eyes, but they sometimes miss or use some information which may help us to identify or link it to the patient back, which should actually not be done. And this becomes one of the role of the peer reviewer to check for that all the patient information is already de-identified and confidentiality has been preserved. Now, consent and ethical approvals, very important aspect. Now, consent, informed and signed consent, both for the participation in research and to publish the data specifically in the case report, is a very, very important aspect. Many a times we do a case, we think of publishing a case, but we just omit it. And then second case comes after a few months, then third case comes after a few months, and then we have a bit of case series with us. Now, even if we want to publish, still patient consent, even for retrospective case series, is very important. So ethical approval, sometimes ethical approval is required from the IRB, that means institutional review boards, for a publication of case reports. But a couple of times it is the duty of among the laws of the IRB, specific IRB for a given dental school. They may go for a waiver of ethical approval only for retrospective case series or some other kind of case reports. So there might be some exceptions, but do remember that it is the duty of the peer reviewer to check for ethical approval or IRB waiver. in the exceptions, to every rule there is an exception. In the exception, sometimes consent may also be waived off, but that decision should not be left to the authors, but that decision is left to the journal editor and the publication committee. IRB may also waive ethical requirements, but that should be checked by the peer reviewer. So as I told you, step 4 means consent and ethical approvals and patient anonymity. So next step is to check for the impact on clinical practice. The impact means this is very important aspect for the final decision of whether to publish a case report. Now, main thrust or carry home message needs to be emphasized very clearly, because this is the major aspect by which people will be encouraged to write and read the case report. If a case report is published and not useful for the readers, then it is not making the impact in the clinical practice. So such case reports do not add on any citations, not read by, not reflectable, so it will not make good add-ons in the whole medical literature. It needs to be, this aspect needs to be elaborated upon in the concluding remarks, as I already mentioned. And hence it's very important for a peer reviewer also to check that the impact on clinical practice is there and is also highlighted in the manuscript. So that is very, very important. So step 5, writing the feedback. We have already seen yesterday and day before how to write the feedback for authors. I just I will say just 4 points. It should be constructive, very, very important. It should not be derogatory comments or something like that. It should be constructive. Even if you are rejecting a paper, then even the feedback should be very constructive. Imagine, even in the pebbles, one person can give a good smile. So it should be constructive. It should be reflective. Reflective simply means that the authors should be able to reflect back where they went wrong. It can also be query based. You may find that the case is very interesting, but some points are missing. So you can just ask a query. It can be suggestive also, that this particular case is very interesting, but actually this is not of the interest of your journal or something like that. Or you can redefine the case in this manner, such a manner, so that we are able to take the case again. So many literature always suggests this, writing the feedback, but I'll try to change the word. It should be called as feed forward. It should not be called as feedback. So once all these steps are followed and the complete cycle of reviewing and re-editing the paper and final publication is done, then the ball comes in the court of reader. So the third duty, as the same person, he can be an author or she can be an author, then maybe a peer reviewer, finally, or he or she can be a reader. As a reader, you are already well versed that we really we need CASP checklist, that is critical appraisal of skills program checklist, by which you really review a published case clinical research or a systematic review. For a specific case reports or case series, we have a different type of checklist which is released by the Jonna Briggs Institute, freely available on the internet, that is called as JBI Critical Appraisal Checklist for Case Reports. It is an 8-item checklist. Again, the same items in a different way are used by the readers to really know what is the what information this case report is actually telling us. If you focus on the last question, it really says, does the case report provide takeaway lesson? So if you just go by all these 8 questions informally, whenever you are reading a case report, you are trying to answer these questions only. A postgrad student or a young researcher, if he wants a critical appraisal, a formal critical appraisal of a case report, then these types of critical checklists are used. So if such articles stand, if all the answers are yes, such articles really stand apart and they are very well read and cited. Once more articles are read and cited, the author becomes very happy. And if the authors are happy, more articles are read and cited, it improves the citation factor. And if the citation factor is improved, the happy editor is also there. So with these words, I will say happy research and happy publications to all of you. Thank you once again.
Thank you, Neeraj. It was very, very clear. The messages you gave, I think, are very clear to everyone. The pointers you gave, stepwise, the checklist, all things are going to be benefiting our participants. There was one question from some of the participants about the case report writer. Is it freely available? Means
it is totally freely available. The link for the care writer can be seen from the carestatement.org website, and they do have a course which is paid. Please don't use that link. They have a case writer that I think it's also available as an app, but it's more useful to use the website because it allows you to do some editing on the computer also. So it opens the window one by one, and you start fulfilling, or as you say, you start adding what the content from your Word, copy and paste. The main intent of using such apps or such websites is that you don't miss on any points, and in the end you don't need to check your manuscript against the checklist, and the case report is finally ready with you.
Thank you. May I request Professor Imran Khan for a quick question, because we are running, we'll go late otherwise. So we'll.
Yeah. Hi, ma'am. Good evening.
Yeah.
Good evening, Neeraj sir. Yeah, Neeraj sir, my question is, when do we decide that we send our case report to a specific case report journal, or we send it to a normal journal? Because numerous case report journal for the last 4 or 5 years have been, there in the market. Like we have the British Dental Journal, we have oral maxillofacial surgery cases as well, my specialty. So when do we decide that this specific case report is suited to this case report journal, or should we send it to a general journal, sir? Thank you.
See, I think it's more of a subjective decision of the common word novel. Novel, something may not be very novel for you. For a BDS person, seeing a case of TMJ ankylosis may also look a very novel thing, but for an oral surgeon, it may not be very novel. So it depends. Definitely, a new author will try to report, or that's why so many cases, new and novel cases, people shirk from reporting. They think that it may not be very well accepted by the authors. It's we need to be outwardly in this total world, because anything we think can help to any of the stakeholders in the whole medical community, that should be reported. And we should not be shirking from reporting into the best of the journals, even if it comes back from a peer reviewer comments. As I told you, one person has to play many roles. He has to be an author, he has to be a reviewer, he has to be a reader, and one of these roles is editor, or a co-editor, or an assistant editor. So please, if you have a very good case, don't shirk. Regarding the choosing of a journal, it depends upon the subjective preferences and reading the instruction of our authors mostly, and also reviewing the previous published journals, previous published articles of that journal. It gives you a fair idea what kind of articles are accepted by that journal.
Yeah. Thank you so much, Neeraj. Actually,
Thank you,
most of the journals are going to accept any novel, any excellent case report which is presenting any extraordinary thing. So yeah, any good journal will take it if it is.
Yes. Every case is a new case. Every case teaches us something new, but that may not be novel enough for the whole community. So we want to publish anything which is novel for the whole community.
Thank you, Dr. Neeraj. May I now request you to please stop sharing?
Yes, ma'am. Yeah. Yes, ma'am. Thank you so much.
Stop sharing, and may I invite Dr. Kathy Fan to come up with her lecture for today. Thank you.
Thank you so much for inviting me to participate in your workshop. I enjoyed Dr. Gagani's presentation, and having been I sit back and realize it's a huge time since I started my PhD all those years ago. I've been a reviewer for 18 years, initially with the BJMS, and now with pretty much most of the OMFS journals, journals in surgery and dentistry. And I have to say, I think it's really important for us as clinical academics. It's very important to report our findings, be it a case report, be it original research, be it a case series. These are all very important to publish in relevant findings, because actually it's useful to somebody which will impact on somebody's practice. So I find, so they're all important. Remember that, equal importance. So do share your knowledge is what I can say. Is my slide on now? Yes, right. Okay. So I'm based in London. I'm the academic lead within oral and maxillofacial surgery at King's College London and King's College Hospital. So my brief is to review and original research. It was very interesting because having been a peer reviewer so many years, you almost go into a patter, if that makes sense. And it sort of forced me to think back how do we start, and how, you know, and we can always learn. I think that's quite important. So essentially, right, okay. I think we have to remember we have a job as you know, we have a responsibility as an author publishing, and as a reviewer, because we actually are safeguarding the quality and integrity of scientific research. And that's really important, because someone's going to read that article and they will take that information away and utilize it to treat their patients. So actually it's quite a big responsibility, and we have to take it quite seriously. So our job as a reviewer is actually to assess, is the research valid? Is it good quality? Is it original? Okay, you know, that's fine if there's something similar, so long as it adds to what we have. And the whole point of it, you know, can we produce good science that helps us to produce better patient care? So that's what we're there for. We're all there involved in peer review to improve the quality of papers that are published, that we as clinicians will utilize to treat our patients so they get the best care. So therefore, our job is to read what we've been sent and point out what's the problem. Let's be totally frank. I do not believe there's any clinical academic, scientific, any scientist, in fact, who would say that their research is absolutely 100% watertight. It's actually knowing where the flaws are they acceptable? Are they major that we've actually got to deal with? You know, that's a problem. We need to correct that. Or have they actually acknowledged where those issues are? So we've got to, as a reviewer, point out where are the flaws in the paper. Yeah, have they actually used an appropriate method, and have they presented the data well that we can understand and we can follow through, and is their conclusion appropriate for what they have shown us? And as also sometimes, you know, you have a break and you go back and think, oh, I didn't write that very well. And you can imagine, therefore, as a peer reviewer, that's your job to notice that. And sometimes you have to give the authors a little nudge and say, you know what, actually, it didn't quite add up. You know, could you comment on that? And what you want to do as a reviewer is to make sure that you've actually managed to put your thoughts in a way that the editor can take that information and feed back to the authors, positive and not so positive. Yeah, and you know, you want to be a helpful reviewer. We're not expected to think about, as a reviewer, we don't really worry about the formatting, spelling, punctuation. You know, we have technical assistance in the journals to deal with that. I mean, recently a paper was picked up on plagiarism. I get told that I don't have to, you know, I may know, and then I may have a suspicion, but often that is actually picked up by the technical support, you know. And also we're not expected to rerun the research. I think it's quite useful as an individual when you're reading an article. I do tend to think to myself, if I were going to do that paper, if I was going to rerun that project myself in my mind, would I likely get the same results? And that's quite useful as a reviewer to think, but we're not expected to rerun it. But at the end of the day, our job as a peer reviewer is actually to read the article and provide guidance to the editor. We don't make the final decision, and there are usually at least two reviewers, and depending what the recommendations of the two reviewers, there may be a third reviewer, and so forth until a final decision is made. And it very much depends how the reviewers, what their recommendations are. If they're very different, the likelihood that the editor will ask for some more, an additional reviewer beyond the usual two, but it's rare to have one. It's usually at least 2 to 3. So an original research, as I've said, the key to remember is all publications on the whole, whatever subtype, are useful in some aspect. My particular brief today is original articles. So these may be called original articles, empirical articles, or primary resources. But the key is, it's an original article if the authors are reporting their own study. They've done it, they're reporting it. They're not doing a meta-analysis or anything like that. It's their own work. I think it's important as a peer reviewer to know when you are not the right person to do it as well. And I have to say, occasionally I think, oh, that's not me. That's not for me. It's not the right thing for me to do. Maybe that you've just got too much on your plate. You know, we've got the EACMF coming on. I have to say we have, you know, many presentations and posters coming in at the moment. Actually, this wouldn't be a good time for me to do, to accept further workload. And that, you know, you have to be honest with yourself and with the editor and with the authors, because authors need to have the decision on their article in a timely fashion. I think it's very, very important to know what we don't know, because if it's not in your area, it's very difficult. It's very difficult to make valid comments. It may well be it's too much in your area of expertise. Let's be frank, you could be doing conflicting work, and you know, you've then got to say, can you be partial and give partial review? You know, are you can you do that, or the two, your work and their work, too similar that it's very difficult to be to give a totally partial review. So you've got to decide on that. And as the previous speaker mentioned, all of these are confidential. So as a peer review, we are not to share what we've read and what we reviewed, because actually this is someone's work. And until it is published, that's quite important to recall that. I, like the previous author, tend to suggest reading the article a couple of times, really, at least. I tend to do a very quick scan read, and then I go back and have a second read. Within the first read, I'm sort of thinking, oh, this is an interesting article, lots of potential. Then I go through the nitty gritty. So, but the type of things that's going through my mind as I'm reading is, what is the main question? What are these authors wanting to find out? Is it an important question? I mean, on the whole, my topics are usually in oral and maxillofacial surgery. Sometimes I will get things in other aspects of trauma, other aspects of surgery and education. But on the whole, is it something that I think I would be interested in, or somebody would be interested in? Yeah. Is it original? And it's quite useful now. Many journals actually link into to linked or related articles. So it's quite useful to flick through and think, what other articles, what else has been published in this arena? You can also do your own sort of quick PubMed search, and I think that's very useful as well. Then you can have an idea, how different is this particular article to what's already out in literature? And therefore you can then think, is this going to be another, you know, chink to the jigsaw puzzle? This will add to what we already know, and it will be very useful. What we've got to remember, that even with the best project, really interesting results, if it's not well written, that is a problem. However, you know, we also need to identify this. Is it the writing that is a problem? And that occasionally happens. You know, we're not all naturally good at writing. And occasionally we have to suggest, this is a great project, really interesting findings. Actually, I've looked at the results, but it's very difficult to read. And therefore, do we then need to think about suggesting that there is some help for those authors to make that article easier to read? And that certainly has happened during my time as a reviewer. So remember, some things we need to think about. We thought, okay, so we're having a quick read through. Is the conclusion actually consistent with what they've said within the results, within their findings? Have they actually answered the question? Because sometimes they have, you know, the aim of the project is, the hypothesis is, but actually they haven't actually come back at the end to answer the question. And you think that's natural, but actually it is possible because they've found something else. So you've got to check that. It may well be this particular paper completely disagrees with what is actually already published. You know, that's actually really, really relevant. You know, if it's very different, well, that makes it very interesting. What you've got to check, do they have a substantial case to disagree with the published data? If not, Do you need to suggest to them what could they do to make their paper more, more stronger and more relevant? Maybe sample size, things like this, or and as a reviewer, particularly it's an area that you're familiar with, you can make some suggestions there. Look at the illustrations. The illustrations are there to help illustrate the results, make it easier for you to understand. Do they add to, or are they just there to look nice? On the whole, I find that illustrations are really helpful. They help the reader visualize what the findings are. And that's what you want. You don't want them just to be there. So in your first read, you're really thinking about looking, are there inconsistencies? And that's often very, very relevant pretty quickly. That's the major flaws. Are there inconsistencies in what they say? Perhaps are numbered up. Perhaps what they've said at one part doesn't quite, they've contradicted themselves in two parts of the paper. And that can occur as well. May well be the methodology is not quite right for what they are doing. Perhaps they've completely ignored some confounding factors and not actually discussed that. These are all the things that should be going through your mind as you're reading. In terms of the methodology, think about the sample size. Is it big enough? Is it the right sample? Have they recruited the sample in an appropriate manner? Have they got controls? Do they need to have controls? Have they got the correct control? How have they collected the data? Is it prospective? Is it retrospective? How have they collected it? Is it, is it correctly collected? That's essentially what you're trying to say. If it's a time-dependent study, that perhaps you're doing a procedure, you're going to look at outcome. Have they looked at the right time to assess the outcome for time-dependent studies? These are things you need to know. Yeah. Obviously, you've got to know about the, what's the validity of the question? How have they analyzed the data? Are you able to work? Can you tell? Is it something you need a little bit of help on? Yeah. And I have to say, I'll go into that a little bit more about data analysis. And I have to say, it's always useful to freshen up your knowledge in medical statistics, although, you have to have some knowledge of it. And I always feel that our best knowledge is often when we first start as a researcher. We're all very hot when we're writing our own thesis in our PhDs, and then you probably tend to slacken off, and then periodically it's good to get freshened up again ever so often. However, most journals do have technical support for statistics, but you need to be aware of what they're looking at and what analysis they've done. So you've gone through your paper, you've had your first read, you've gone through step by step from the beginning through to the end, and you've looked at all of those facts I've mentioned that you've got to consider. I tend to jot things down as I go along. I mean, and then you've got to think about how you pull that all together, because actually you've got to do a recommendation, and you've got to write that up, and that write-up has got to be sent to the editor and also sent to the authors. Some journals have a section which is just for the editor, and a section which is also to the authors, and others will send the whole thing to the authors. So therefore what you write is very important, and I would concur with our previous speaker about how you feed back to authors regarding their research and their paper. Yeah, so go through section by section. Start off with the first part, which is always the abstract. Read through the abstract. Have they said in the abstract? Because let's be frank, that's the first thing you read. When you go through PubMed, that's the only thing you read first of all. Are they going to pick up the paper? That's essentially, that's the first thing you read. Is that going to be, is all the information there pretty much there? Have they stated their objective, how the study is designed, what the outcomes are, what the important outcomes are, and what the conclusions are? Is there something they've forgotten? You've already read through the paper once or twice, or twice by the time you're doing your review, usually, if not more. Is there anything else that you think that the article through they should actually come back and add? And that's your role as a reviewer. Say, perhaps it will be useful to add this in or comment on that. Yeah, taking into account there's not a lot of words in that section. Okay, you've done your abstract. Start with the beginning of the main paper, the introduction. Actually, is it quite long? Because I mean, on the whole, what I've noticed over time is that papers are quite, in terms of, you know, there are often 3,500 words, and therefore you've got to think about, you know, have they used all of their word count in the introduction before, you know, you want a good bit in the discussion as well. Does the introduction, is it too long? Is what's written there appropriate? Does some of it need to be moved to the discussion? Think about it. Have they cited all the literature? Look at, you know, you do need to check, and I'm often flicking backwards and forwards when I'm reading a paper and think, okay, so that was that, so okay, what year was that? And that's really relevant. And you may yourself be aware of literature which is more recent. As I said, often it's useful to look at articles in that topic, and then you'll also be aware if they've missed out some key papers that you feel it might be worthwhile them adding in. Have they stated the hypothesis, what their aims are, and is that quite nice and clear? So someone reading that knows exactly what's going on, what the status play is at the beginning, and what the authors are trying to find out. The method, that's very important. Is the method appropriate? And is it stated? Is the sample size adequate? Have they obtained the sample size? For example, is it consecutive? How did they choose that 200 patients? Was it random, or did they take it from January to December? You know, is there any bias in it? These are things you're thinking. It's going through your mind all the time. How do they choose the control group? If they don't have one, why didn't they have one? Is it because it's not appropriate to? Yeah, our previous presenter mentioned about ethical approval. You need to ascertain, pretty much most studies have ethical approval now. I mean, I have to say there is a toolkit that you may be aware of, certainly within the NHS. We have a toolkit that I send my team off and just say, I may already be aware that at the beginning of a project, I think we need to get ethical approval. But I usually say to them, why don't you go and check? Is this an audit, or is this a project that requires ethical approval? Do we need to apply for audit approval, or do I need to apply for IRAS approval? So I usually send them off to do that. There is a toolkit on the web for that, certainly within the NHS, and you may like to check that. And it's quite nice. They just tick through it, ask you questions. Is this a research project? Are patients involved? Or, you know, that sort of, is it part of a clinical trial? That sort of stuff. And it gives them some advice. So I think that's quite useful. But your senior author is often fairly aware of what of the answer to that. If an intervention is actually being assessed, is that intervention adequately described? Have they measured the outcomes accurately? And are they reliable? Have they ignored anything? Perhaps they've, you know, you've gone through and think, well, why haven't they picked up on that? Look, I can see that in the table. So these are things that you're considering as you're going through. Statistics. I mean, you know, as I said, we all need to have some knowledge of statistics. Although, as I say, we're incredibly fortunate. For most, probably all of the journals I review, there is technical support for this, but we need to be aware of it. And you have to have an idea. Have they described the basic data? Have they talked about, you know, sometimes it says it's significant. What do they mean by that finding is significant? Significant difference. Is there a p-value? These are things you're considering. Often we like to have absolute values as opposed to greater or less and whatever. Check the numbers. And I think that's a very easy thing to say. It may be an honest, it may be just one of those things. You know, they've removed some, they've removed some cases for whatever reason because they, you know, and they would, but they've forgotten to mention why certain patients were excluded. But you need to check the numbers throughout the paper. Do they add up? Do the tables add up? That's very important. Have they forgotten about something? And I've already said about the statistics. The graphs. I think graphs and tables. I think a good illustration can say many, many, many words, and you can literally look at it as you visualize it. And I think that's when it's a good illustration. That helps me as I'm reading. I can look at the table. I'm thinking, yeah, okay, that makes sense. Yeah, that makes it much more understand. Are they useful? Are they good quality? Can they be improved? Do you think they've got, you know, have they put it in the way that makes it easy? Is it a table? Is it Is it well laid out? Or is it a bar chart? Would a pie chart be better? These are things you're thinking, because you want to be able to read the text and look at it and think, right, that's what the authors have found. The discussion, I mean, the discussion is such an important area. Not only discussing what they have found, but actually what the problem with the study is. Let's be frank, as I've said right at the beginning. I would say that you can always pick a hole in any paper, any project, but it's being aware of it and how you're taking that into the context of the findings. How does your findings compare with other studies? And can you say, do the authors say why their findings are different? Is the location different, timing's different, the age is different, the review period is different? Why have they found something different? And can they justify what they have actually found? I think important, I tend to ask myself at the end of reading the article and actually writing my, my review, if I was going to carry out the same research with the same method, would I get the same result and conclusion? And I think that. I'm not going to do it, but I think that. And can I adapt the findings of that paper and conclusions into my practice? Because that's actually really important. That's an interesting paper. That is going to impact on my treatment. So that is a, that is a very important article. Having done all of this, you have to, unfortunately, click the box. And I think most of us would like to ideally accept everything, if it were possible, but you can only accept what is appropriate to accept. Yeah. Got to decide, are you going to reject it? Why are you rejecting that paper? What is the reason? What are the issues? What are the flaws in that paper? And you've literally got to put it down point by point. And where can the authors improve? May well be they need a longer review period. Maybe they large size. Perhaps they need to look at one other thing. These are things you've got to say. May well be it's incredibly well written. There is no revisions from a scientific point of view. It's not to say the technical editor won't find something for you, but from the clinician and the scientist, we don't find anything. And therefore, it may well be nothing needs to be done, yeah? So then you've got, and then in terms of the revision, is it just minor things? The minor things often, oh, actually that didn't really make sense. That was, perhaps they could write it this way, but they haven't, sort of minor little things that need to be adjusted, or perhaps you need them to readdress the way the data has been reported. But essentially the key is, as our previous presenter says, you need to give us a peer reviewer constructive feedback. How can the authors improve that to get that paper published? So I thought this was quite nice. So this is on the Wiley site. So be critical, but be constructive. Yeah, reviewing with empathy. I think that's a very good thing. Be critical, but constructive. Focus on where they can actually make changes. Yeah. Okay. I mean, it is really important. It's not appropriate to be rude just because people don't know who you are. I mean, most of our, it's not appropriate, really. Meet the deadline. I think that's something, we are all incredibly busy in our jobs, and we have to sort of put your hand up. Love the topic, really interesting article. I can't do the review within your time scale. Happy to do it within this time scale. Do you still want me to do it, or do you want to move it on to another reviewer? That's okay. The editors can make that decision. It's not for us as reviewers to decide on that. And we've mentioned about the confidentiality. If it's your paper, you don't want the reviewer to be telling everyone about it, if that makes sense. And bias, this is the conflict of interest I was talking about. Certainly within maxillofacial surgery, within medicine, there are, relatively small areas. So occasionally you are asked to review. Of course, the editors will ask you to review articles in your area, but is it a little bit too close for comfort? And actually it's not possible for you to give an unbiased review. So these are things to think about, really. So I think all in all, I think we have to remember it is an honor, you know, for us as clinicians, it's an honor to be asked to review someone else's work. And I think that's important to remember that. And therefore we have to remember we have to take our job seriously. The journal's relying on us as reviewers to do a good, and job of actually reading the article and giving feedback on it. Their reputation relies on it, but not just their reputation. Once that paper is accepted, we are also relying on it. We're relying on each other to be appropriate peer reviewers. Yeah, we are that information is then available for us to utilize and impact on our practice. So therefore, remember, it's a total honor to do it, and do it well and do it seriously. So, well, thank you. This is us in London in different times when we were when we're able to stand next to each other, and I've just moved away because the other office was next to the helicopter and it kept going off. So that's why I've sort of moved halfway through. But thank you for your attention.
Thank you, Kathy. Very, very informative lecture. I must say, I too prefer to give just a very quick read and then stop, as you said, section by section. And just I like to highlight in my first read whatever is like I'm stopping at something, it's striking my mind, then I stop there, highlight it, and then in the second read I just take up those points. So very true. Then again you said constructive but critical. That is so much required, that it has to be a critical read, critical comments, and never the etiquettes of a reviewer. Be doing a job as per the timeline, be empathetic. I can't re-emphasize the words you have used. It's so very true. So the audience participants, we may have your questions. Please raise hands. Professor Imran Khan, you are there again.
Yeah, ma'am, can I come in?
Yes, please.
Yeah, good evening, Professor Kathy. It was a nice presentation. Thank you for the same. My question to you is, some of the journals will indicate that in the author section that for comments for authors, you don't write your rejection or acceptance. So how far do you justify that? Should we empathetically write that it is rejected, or we are sorry, we apologize that, but it does not fit scientifically, or what do you advise on this? Or should we just write it to the editor's column that this has been rejected or accepted? Thank you.
On the whole, I've personally never written within the comments that this has been accepted or rejected, because it's not for us to reject or accept as the reviewer, as a peer reviewer, because we're just one of the reviewers. There may be 2, 3, or occasionally 4, and you will have the same, that occasionally you're the 3rd or the 4th reviewer, because obviously it's an interesting topic, but there's some aspects of it which is obviously causing a little bit of stir, shall we say. So therefore, I don't say within the, I don't usually write within the comments whether they've accepted or not. I just usually literally just put my comments, or where I think actually these are really positive points of this paper, really interesting. I really like that. However, these are the areas that actually I didn't quite understand, or I think it could be improved, or perhaps the authors could do that. So I don't personally write accept or reject within my actual writing, only within the tick boxes where the drop down says, what are you doing? Are you asking for a major revision, minor revision, accept without revision, or a reject? And if you're going to reject, are you going to accept the resubmission when it has been rewritten? Things like that. So that's within this. I don't write it within the actual.
Thank you, Professor Kathy.
There's one more question for you, Dr. Kathy. Should the reviewers check each and every reference also to see if the information cited from it is correct?
It's difficult to check every single one. I think it is very difficult to check that, but I certainly do. I personally do pass through all the articles, just and you find as particularly as your area, you have a fairly
Yeah.
I mean, I don't know what your Dr. Professor Malhotra, I don't know what you do. I think it's quite important. I do glance through all of the
Yes.
all of the references,
Yes.
and I look at, and then, as you say, unfortunately, as you get on, you sort of recognize a lot of them.
People sometimes think that the reviewer is just going to read the article and don't have the references in the proper format, or they are very old references, so they have to be updated references, have to show that whatever you are doing is something related to the current literature, so recent. Then you can actually not go and check all the references, but yes, you do give a glance of all the references there, and you also check online if similar articles have been there. So that is a must do for all the reviewers to uh, do a title search, so what new has been published, and whether that new, if you found that it should have been cited here, is here or not. So that check has to be done by the reviewers. And most of the time, what I see as a reviewer is that many a times the article is going on saying something, the data, the results of the, they are different things, but when it comes to conclusion, whatever has not been studied in the article is coming in the conclusion. So relating the conclusion to what all the methodology was is really important.
Absolutely, yes. So it is important. It's not to say it's not a good paper.
Yeah.
You might need to suggest that they take a slight different slant on what they've said, because they can't substantiate their final conclusion.
Yeah.
And yet they've actually got very valid results. They might just need to tweak what they've written slightly.
Yeah. Thank you so much. I think, is there any other question for her?
Ma'am, we have a previous question from Dr. Nishat. She asks, as part of most of the OPD forms, consent is taken from the patient. Agreeing to the treatment that will be given now, even ethical clearance is being asked for the case report. So this is for Dr. Gugnani. So how to go about it? Like what she says, if we do a case, we do a biopsy, we take a consent, a prior consent. So when we are submitting the case report to a journal, would we still need an IECF? From what role does it have to play? That's the question.
So should I take it?
Yes, sir, please.
Okay. See, whenever we are doing a clinical practice, the case comes, we diagnose the case, we make the diagnosis, we make the final treatment plan, and then before treatment, we take a consent. So even in a clinical scenario, while doing an everyday OPD, we take a consent. We need to take a consent. But in a clinical research, whether it is because if you are planning a novel thing, you need to take a consent that you are trying to increase the dose or something new thing. We are trying to some new intervention or some newer design of intervention we are trying to do in that case, or in a clinical trial, we always need to follow the ethical guidelines. And the basic principle of all the ethical guidelines is just one line: do no harm. So if you are doing something new, harm can occur, and that's why informed signed consent role comes into play. So now in retrospective cases, if you have done a biopsy and you didn't take consent or something like that, but if you want to publish, publication consent is still required. So that consent to participate and to publish your data, even if it is anonymized data and decluttered data, still consent is always required if you want to go publication. As I mentioned, that sometimes in case series, some of the retrospective consent might not be possible. In that case, the final decision do not depends upon the author. The final decision depends upon the editor of the journal, the publication committee, and the IRB board, and no one else.
So in those cases, the final IEC clearance would not be required.
IEC clearance is not dependent upon the editorial requirements for case reports.
Right.
IEC clearance is the requirement of the IRB board. So if your institution actually allows you to go ahead for retrospective case series without IRB, with IRB waivers, the editor and the peer reviewer will check only the waivers are there or not. So
Right.
that requirement for case series is by the department and the institution.
That was basically the question which was asked. And there was another question which came in WhatsApp late in the evening after we had finished the session. There is a a consultant who's working in a teaching hospital right now and who's engaged in some kind of research at the teaching hospital. So any kind of research which goes from that particular teaching hospital is going to go through the IEC clearance as well. But this particular person would like to resign from his academic post and has a private setup. He runs an oral and maxillofacial radiology center. So he wants to publish data from his private center. And then the question is, would they be, how does he get an IEC clearance in that case? Because he's not associated with an educational institution or an academic institution at that point of time.
See, if he started the research way years back when he was there in the hospital or the academic institute, he must have taken the IEC approval before starting the research.
True.
Now, after leaving the job, if he plans to do some new research only in his private hospital, then he or she must be get in touch into some private ethical boards.
Right.
The government of India allows private ethical boards to be set up, which are available in Delhi, in Ludhiana, in North Bombay, and many places which are DCGI approved ethical boards. So
right.
for a prospective research which he plans to conduct in his own clinic without any academic institute, he can approach those private ethical committees which are also DCGI approved bodies.
Okay.
I
That's
agree.
right.
So
Thank you.
many
Like
times
some clinical trial centers are there in India, which does only clinical trials, and they are not academic institutes. They also go for these kind of research, and they also go for IRB approvals, not by the institution but by the private ethical bodies.
Divya ma'am, your take on this?
Yeah, I was also saying some hospitals also have their individual ethical review board. So
Yeah.
either make use of that, or a nearby institute, you can ask the institute, go to them, go to the research cell or
Yes.
institutional review board and ask, I'm a practitioner in the local area, can I submit my for ethical review? So
Yes.
that sometimes that is also accepted. So it has to be there.
So there are a few more questions.
If I just try to add something, there is a network called as, if I don't remember the exact name, it's a PRAIN network, PRAIN. So it actually encourages the private researchers, that means the private dentists, private medicos, to continue with the research.
Right.
It's an international network body, because people in clinics, they might be a good researcher, because then they lack facilities, then they tend to go back into the loop and just focus on practice. But if you are still interested in research, there is an international research body which encourages even all practitioners to be part of that body to continue with the research.
Right. So thank you so much. That's
Thank you.
very
Thank you so
helpful.
much. Kathy, there is a question
have
for
a
you.
few-
There's a question for you. What may be the advantage of open reviews? So do you recommend open reviews? What is your opinion on that? This is Dr. Divya Sharma asking you. Sometimes some journals.
You'll have to mute yourself. I'm sorry, you're muted.
Apologies. The question was, what do I think of open access, open review?
Open reviews. Some journals do accept reviews and they publish it and then they are cited. So would that open review policy be adopted by most of the journals? Because that gives reviewers some credit, because their reviews are now citable as well. So now there are only very few journals which are doing it at present, but maybe in the future more and more adopted. So
I think it's a good thing. It makes it transparent. It makes it more transparent. I think transparency is always very important, as I say, you know. So I think that's a good thing. Yes, you're quite right. There are a number of journals which will now say to you, as part of the happy for us to, and they will publish it. I've personally not seen where that is published, but I think that's all in the positive direction.
Yeah, thank you. So with this, if there are no more questions, Ashiv, you were saying something. Is there some?
Yeah, there was a short question.
Yes, please.
How many hours does it take minimum for a reviewer to research a paper? So that's about 4 hours. So I've answered that on the chat box. A few more questions. Dr. Kathy, they would like to know whether the reviewer should check for statistical data as well while reviewing a paper.
I think it's very important to look at the statistical technique and does it seem appropriate? And certainly if you have any concerns, we are able as reviewers, and certainly the journal is able to ask for the actual raw data, most journals do have a statistician on board who will also, if you have any concerns as a reviewer, they will look at that. My gut feeling is any paper that we accept, they probably do look at it anyway. But certainly, if I've had some concern, I'm not sure about the, they've looked at this way. Is that correct? It will be checked. I don't know what.
Yeah, I think you can make the editor aware that you have checked the rest of it, leaving the stats behind, and then some reviewer from the stats field can be incorporated in the reviewing system so that that part is taken care of.
We'll take one last question, Divya ma'am, before we wrap up.
Yeah. Yep.
Dr. Sonal would like to ask, this is for Dr. Gugnani, sir. Does an original article require a clinical trial registry number to be mentioned when sending it for publication?
Most of the good journals are actually requiring clinical trial registration number if it is a clinical trial. Earlier in India, we were allowed to do some retrospective registrations also, but for now, for last many years, CTRI, that is the Clinical Trial Registry of India, really requires us to do a prospective registration, and it is a free, completely free, a very easy process. Even a postgrad student, if you are a faculty or postgrad student, the postgrad thesis should also be registered if it is a clinical trial. Even if you are doing a phase 4 clinical trial, just trying to check for the post-marketing surveillance of any product or any, even if it's a behavioral intervention, anything, it should be, you should have a registration number.
Right.
Good journals really require registration number. The main intent is to make everything transparent, the whole process, because we don't want to have any post outcome reporting biases to be found at the time of systematic reviews and at the time of culmination of all the data.
Perfect. Thank you so much. A few more
Thank
questions
you.
are there, but they're on systematic review. Sorry.
So we'll take up later.
Yeah, we'll take them later.
Yeah.
And I think we can wrap up, ma'am, over.
Thank you, everyone. Thank you, Kathy. Thank you, Neeraj, for excellent presentations. And thank you, dear participants. You
Thank
are
you
the
so
real
much.
leader behind all this. So what you want, we are going to offer you that. So thank you so much. So see you again tomorrow. You will receive a feedback form on your WhatsApp group. Please fill in so that we know what you like and what should be taken. Some modifications are needed somewhere. So we'll take care of that. Thank you, everyone.
Thank you
very
so
much.
much. Thank
Thank
you
you,
very much.
Kathy.
Bye-bye.
Thank you.
Bye.